Hello everyone, welcome back. My name is Eme Kolom Obiadulum from Osageduwa Ame Foundation. Today we'll be talking about schizophrenia. For our last of various videos we dropped on our page on Facebook, Instagram and YouTube. If you know you haven't watched them or followed us on our various Instagram or Facebook or YouTube handle, please do well to do so. So right about now I'm about to dive into the topic of today, which is schizophrenia. So please sit back and enjoy, and make sure you take a pen to learn one or two from this video. Welcome back. So today we're talking about schizophrenia. So what is really schizophrenia about? A lot of people have a lot of questions about what this is, because actually it has been discovered through research that 15% of individuals who are admitted in psychiatric hospital are schizophrenic. What does this tell you? It is a common, one of the most common type of mental illness, and it starts for male around the ages of 15 to 20, but for females around 25 to 35. But it can also be evenly distributed among these genders, and it is most common among individuals who are in the lower economic group. They experience it more. Then moving on to the causes of schizophrenia. There are a lot of causes of schizophrenia, but I'll be giving you just a few. You know, the hereditary, it can be transferred from the mother to the child through genes. Through the gene of the parents, the child may inherit this schizophrenic condition. It can also be due to stress. Due to stress, it can be due to stress. A lot of stressful life activities or events may have propelled them and caused this schizophrenic condition. It can also be due to alcohol abuse, drug abuse. It can also cause schizophrenia. A lot of people too also experience head injury. It might be through a fall, it might be due to an accident. It can also be caused by cerebral tumor. A tumor can also cause a schizophrenic condition, or it can be caused too by poor relationship between parents and the child. When the child has a very poor relationship between the parents, it can also cause this. And it can also be caused by poverty. Yes, poverty can cause schizophrenia. It looks shocking, but yes, it can cause it. Poverty can make it go insane. It happens. It's one of the causes of schizophrenia. Moving on, I'll be talking about the types of schizophrenia. For the types of schizophrenia, we have several types. We have unorganized schizophrenia, we have catatonic schizophrenia, we have paranoid schizophrenia, we have residual schizophrenia, we have simple schizophrenia. These are the types of schizophrenia. Then I'll be explaining each of these type of schizophrenia. For the unorganized schizophrenia, it can also be called hemiphrenic schizophrenia. The onset is usually before the age of 25. This person loses touch of reality. The person's behavior is usually regressive and primitive. The person finds it very difficult to communicate with people in society, and the person's hygiene is extremely poor. This person in question does not understand or can relate to things happening around him or her. The person loses touch of reality. This is for persons with disorganized schizophrenia. Moving on to the next, which is paranoid schizophrenia. In paranoid schizophrenia, this individual might be experiencing delusion of persecution, suspiciousness, hostility, aggressiveness, poor sleep, refusal to eat. The person has impaired level of communication with people in society. These are some of the features of someone who is experiencing paranoid schizophrenia. Moving on, we're talking about the catatonic schizophrenia. It is characterized by marked abnormalities of motor behavior. It is in two forms. We have the catatonic stupor and the catatonic excitement. For the catatonic stupor, there you have the psychomotor extreme retardation. There's the extreme psychomotor retardation. We also have mutism. The person is extremely quiet. There's also a decline in the movement. The person is just on one spot. The person does not want to move themselves. That is for catatonic stupor. While for catatonic excitement, you have these individuals moving purposelessly. They are moving anyhow. They are hyperactive. These individuals actually experience extreme psychomotor agitation. For the catatonic excitement, these individuals have extreme psychomotor agitation. They are hyperactive. They are violent. They are agitated, like always agitated. They are restless. These are just some of features of someone who is actually experiencing catatonic excitement. For the residual schizophrenia, these individuals may have had one episode of schizophrenia and has a prominent symptom of schizophrenia. The person might also be neglecting their personal hygiene or have poverty of speech. These are just some of the ways to identify someone who is experiencing residual schizophrenia. Then the next we'll be talking about the simple schizophrenia. The simple schizophrenia, it is also known as schizophrenia simplex, is actually from the onset of childhood, but it is gradual. This person might experience lack of initiative. The person might experience loss of drive. The person might experience wandering aimlessly. The person might also experience absence of will. These are just a few ways to identify someone who is having a simple schizophrenia. For the undifferentiated schizophrenia, these individuals do not meet any of the criteria of any of the earlier mentioned types, the subtypes of schizophrenia, and that is why they are described as the undifferentiated schizophrenia. They experience hallucination, delusion, bizarre behavior. A lot of the symptoms that have earlier been mentioned, they experience all of them, so they cannot be categorized into a particular subtype of schizophrenia. They are known as undifferentiated schizophrenia. Moving on, we're talking about the signs and symptoms of persons experiencing schizophrenia. For a schizophrenic patient, the person may experience hallucination, delusion, improper personal hygiene or impaired hygiene. The person loses association. The person finds it very difficult to associate with people, withdraws himself from people. This person might be aggressive. The person might be restless. The person might find it difficult to eat or sleep. Most of them have issues with their sleeping pattern and also with their diet. These are just some of the signs and symptoms of people who experience schizophrenia. Next, I'll be moving to the management of persons experiencing schizophrenia. We are talking about the management of schizophrenia. For a person with schizophrenia, this person is not a lost cause. It is not a lost case. There is help for this person and there is hope for that individual. All you have to do is take that person to the hospital. The person will be given the necessary treatment and the person will fall back to life as normal. Please, when you get there, you might be told to undergo psychotherapy, behavioral therapy, medications will be given, rehabilitations will be undertaken, family therapy, occupational therapy, recreational therapy. There's just a lot of medication that will be given to this person. This individual will also have close observation, monitoring of their diet and their sleep pattern to ensure that they are going to be fine and alright, because their health matters. We at Osageduwa Ame Foundation, a non-governmental organization, we care about your mental health. Your mental health matters to us, and we are open at the hours of 9 a.m. to 4:30 p.m. from Monday to Friday. We offer free services of rehabilitation counseling, and we connect you to the right source of treatment, because your health matters to us. Thank you, and we hope to see you in our next video. Bye. We love you.